Okay, so we're live.
Yeah.
Hi, Priya. Good
Hi.
afternoon. How are you doing today?
I'm doing good. Yeah, how are you?
Not bad. I'm doing all right also. Thank you. Okay, so thanks again for doing this with me. Can you introduce yourself?
Yeah, so I'm Priya. I'm currently a second year STP in Haematology and Transfusion in the Nottingham Hospitals Trust.
Okay, then what about your pre-STP background?
Yeah, so I graduated with a biomedical science degree with a placement year. So I was a HCPC registered biomedical scientist before this, and I graduated during COVID. So I spent a few years working in COVID labs, and then after that, I worked in a hematology and transfusion lab for less than a year, and then I got the STP.
Wow, that's interesting. So when you say COVID lab, is that different from the NHS lab?
So I did spend some time in an NHS COVID lab and a COVID lab that was just built during COVID time.
Yeah.
And yeah, it was quite a different experience. But yeah, so I've worked in both, really.
That's cool. So then let's talk about the STP application. What was your STP application experience?
Yeah, so I had actually applied for the STP when I came out of university, and I did get rejected at the application process. So yeah, I'd done the application and situational judgment test, and I got rejected. I'm not sure if it was the situational judgment test or the application because you don't get feedback. Yeah, I then reapplied after a few years of being a BMS, and for the application, for me, we had to do 1,000 words on supporting information, which was kind of about, your genuine interest in hematology and transfusion, transferable skills, any experience you have basically, and also the NHS values. And yeah, I didn't find that bit too bad because I had more experience, so I kind of was able to put that in there. The situational judgment test, I feel like everyone finds that difficult.
Yeah.
But that was like, yeah, there's a time limit and, you've got all the options and stuff. So it is quite difficult. And to me, it's kind of a blur. I wish I could say more about it, but yeah, it was quite difficult. But yeah, I managed to pass. So fine, yeah.
Yeah, the situational judgment test is a very weird exam.
Yeah,
You're not sure if you're doing the right thing or not. So I think it's
exactly.
usually the same experience for everybody.
Yeah.
Then, since you got in your second trial, would you say your work experience made your second application better, or how did you improve your second application compared to the first one that you did?
Yeah, for me, I feel like it did help to improve my application because I had a lot more lab experience, especially in hematology and transfusion. So I was able to talk about that in my application. Not just transferable skills, but exactly what goes on in the lab. So yeah, for me, it did definitely help. And I feel like, yeah, in the previous application, because I had no sort of experience in hematology and transfusion, I didn't really have much to go on when I
Yeah,
wrote it. Yeah.
yeah, that makes sense. Then, what about your interview? What was your interview experience?
Yeah. So yeah, it was longlisted and then shortlisted. And then we kind of got ranked based on, our application. I was ranked third, so I was able to get my interview in my first choice. And the interview was with 2 deputy service managers and 1 training lead so the 2 deputy service managers, one was in hematology and transfusion, and then the other in transfusion. And then we had our training lead for hematology, who's now my training officer. So the questions were quite varied. There was quite a bit on actually like the technical skills and the theory in hematology and transfusion. I feel like if anyone was to do their basic research on, hematology and transfusion, it shouldn't be too bad. Yeah, the questions weren't too bad. And then there was some on transferable skills, things like teamwork and communication. We had questions based on that. And yeah, I think that was, and oh yeah, there was questions on NHS values as well for me. Yeah.
So for the interview, I know you were already working in a hematology lab, but while preparing for the interview, did you do anything differently, or you just went in because you already had the experience in a hematology?
So I did do my research still on the Haematology and Transfusion STP. I spoke to people on LinkedIn trying to get kind of information on the whole process. But yeah, I would say that working in that role did help me a lot. In terms of why I picked the specialism, yeah, working in hematology and transfusion definitely made me see like how everything is connected so much. Like hematology and transfusion, they kind of go hand in hand. And yeah, it did help me to see why I was so passionate about it. I've always had an interest in hematology and transfusion. The tests, I mean, if you go to the GP, one of the main tests you're going to get is a full blood count. So it's very important. Transfusion is so rewarding, directly saving lives. So yeah, I've always been quite passionate about the specialism. Yeah.
Then talking about your specialism and talking about transfusion science, I know you're in second year right now. So for your first year, what rotations do you do?
Yeah, so in your first year, you do rotations in chemistry, genetics, hematology, and transfusion. And yeah, we basically moved around those rotations in your first year.
Okay.
But yeah, I would say it was very useful actually. It kind of does help for people who don't have experience in an NHS lab. It definitely helps to see what the pathology service is like in general, and how everything kind of connects. So yeah,
Yeah.
good.
I think that's true because I'm just rounding up my hematology rotation,
Yeah.
and then it's very important to me because we do for second year. I'm going to be doing hematological malignancy,
Yeah.
so coming down to do the basic hematology to know where it all starts from before it gets there. I think I like that part of the STP where they take you to the very basic to have a good understanding. So now I'm talking about your specialty. And with the little experience I've had in hematology, I know that for authorizing results, the biomedical scientists also do that. So I was trying to figure out, so who then is a clinical scientist and what then is the role of a biomedical scientist? So can you put us through what the role of a clinical scientist in hematology and transfusion science is?
Yeah. So in my hospital, there's no clinical scientist in hematology transfusion. I'd say it's quite rare to actually have one. So there's no actual defined role. I feel like it varies based on the trust you're working at. They'll kind of pick up specific roles based on what is required by the trust, which is quite cool actually, because no two clinical scientists will be doing the same role. It's quite varied. So I can take you through what I've kind of seen from a clinical scientist role. I've seen like consultant clinical scientists, so I kind of have some of the roles. So you'd be doing a lot of interpreting morphology, bone marrow reporting, kind of aiding clinical staff with interpreting hematology and coagulation results. You'd be doing training in terms of biomedical scientists, hematology registrars. I feel like specifically morphology training. So yeah, I feel like they would be kind of the roles of a clinical scientist in general.
So, for persons that are looking at applying to hematology as a specialty, or maybe persons that are just curious about hematology, so if you're asked, so what's hematology about? Can you just give a brief overview of what your specialty is just about?
Yeah, so hematology is just covering the lab processes such as full blood counts, coagulation tests, looking at blood films, so morphology. So that gives you like the big picture on various conditions, something as common as anemia to more like leukemias, blood cancers. And transfusion science is more like focusing on like the safe provision of blood components and blood products to ensure that the most compatible products are given to patients, and monitoring for any effects such as transfusion reactions. So yeah, for the role, it would be kind of, because biomedical scientists kind of do the main authorizing of results in hematology, it would be more the clinical side of it. So the kind of the roles I mentioned previously. Yeah.
So, for the university part of the STP, what uni do you?
Yeah, so in our first year, we actually were part of University of Manchester, and then we transitioned to Manchester Met, a university in second year, and will continue to be there for final year.
Okay. Then, how do you balance your time on the STP? Because, we have the work-based competencies, which are the training activities. We have the university part, the exams, so many things to do. So how do you balance your time and across both?
Yeah, so I'd say one of the biggest challenges of the STP is definitely managing the workload. So, yeah, there are times where it's kind of built up, especially when there's university deadlines and you've still got to be going to work and doing the one file competencies. So, I've had to obviously put one file on pause whilst you're working on the university deadlines, and you can feel like you're behind. So I do try and get most of my training activities done during work. I mean, of course, that's not always going to be the case. It depends on how busy it is, but it is useful to spend a few hours each day for me to work on my one file competencies, because you have all the resources you need. And this also means that I get time to do things outside of work. I mean, I like to keep active, keep fit, so I like to do a lot of other stuff during the
Yeah.
week. So yeah, I feel like it's important to have that work-life balance, isn't it? So yeah, I try to, in terms of keeping on top of it, I try to make sure I log evidence as soon as I kind of get it, which I'd definitely advise people starting the STP to do. And yeah, so you can kind of keep track of it. And then I also, because it had been a while for me before going back to university, I did have to like relearn what my revision style is and dealing with coursework and deadlines. So I did find that a little bit hard during first year, but I mean, it came back quite, when you have the deadlines, you kind of,
Yeah, you don't have any choice. You just have to meet
yeah,
it.
yeah. So using your study days wisely, be very beneficial.
Okay, so as a trainee, then what's a because if I say typical day, it might not cover exactly what we do because in an entire week, I don't know about you, but I get a study day and I sometimes you get to do different things. So what's a typical week in your life like as a trainee?
Yeah, so a typical week. So I'm currently in my transfusion rotation, and I spend a lot of time in the lab because transfusion is very hands-on. So currently on the manuals bench. So I come in, we'll have our handovers, our little lab meeting to get some updates on what's going on in the lab. And then I kind of sit with the biomedical scientist and would work through the work in the manuals bench. So for us, this is anything that's kind of tested on the analyzer. We'll go through any abnormal results. And then some of these may need antibody investigations, so it requires doing antibody panels. So we'll kind of work through that manual work together. And then there's also things like a Kai-Hauer test, which is for fetal maternal hemorrhages. So we'll kind of do basically any tests that are required in the manual bench. And then I try to spend, like I said, a couple of hours, maybe at the end of the day, working on kind of doing write-up. And then kind of in my first year, I did spend a few days going to clinics as well, specifically clinics in haemophilia, coagulation side. So yeah, we do that. But most of my time I do spend in the lab for my uh, specialism, yeah.
Yeah. So when you get competent in a particular, let's say, analyzer or running a particular test, do they include you in the rota? So do you actually get to do service work now that you're in second year?
For me, I actually don't get included in the rota. They still treat me as supernumerary, so I'm still treated as a trainee rather than someone who's doing service work. So yeah, I don't get put in the rota, but I kind of do try and help out where I
Yeah.
can whilst in the rotation.
Okay. So what would you say the transition from first year to second year is like? Because I know that in first year you are doing a lot of external rotations and now you are in second year. Have you started your research? Because I know we're supposed to do a research. So have you started it? What is it like being in second year right now?
Yeah, so in first year, of course, you're mainly just observing. So yeah, a lot of observing different disciplines. And yeah, that was kind of my first year. And then in second year, yeah, I had to submit my project proposal in December. So we started thinking about projects kind of straight away in second year. I have actually started working on my project. So along doing the kind of rotations in our specialism, kind of working on the project as well. So yeah, I've kind of started doing that on the side, yeah.
Okay, so we'll get into the concluding part. So I know that I've gotten a few comments from people about hematology and how competitive it is, and most times the slots is usually very small. So for persons that are looking at getting into the STP next year, what advice would you give them about how to maybe structure their application to improve their chances? Or
So I would say understanding the role. I mean, it's hard because there's not much out there for hematology and transfusion, but maybe understanding the role of a biomedical scientist in hematology and transfusion, I find is quite useful because that covers a lot of the kind of processes that go on in the hematology and transfusion lab, which would be very useful for someone who's applying for their application, and also trying to understand kind of the clinical side and the theory behind some of the lab tests that are done. I'd also say non-lab experience is quite valuable because there's so many transferable skills you can get from other jobs. So, talking about that in your application would be really useful, and it's something that they would pick up on. Having a genuine interest as well in the specialty is really useful. Also, how kind of hematology and transfusion connect, because that is kind of one of the interesting things about our discipline, how we have two kind of disciplines kind of put together, but they do connect. So that would be very useful. Also, reflection is a big thing in the STP.
yeah,
Training activities are based on reflecting. So if in your application you can talk about how you've learned from different experiences and how you can reflect, I feel like that would be very useful as well.
yeah. Then what about persons that will be going into first year? Of course, they are still having their interview, but for persons that will be coming into the STP next September, what advice would you give it? Because for me, honestly, if I have to talk to anyone about first year, I have so much to say because I know that they say the STP is intense and all that, but nothing prepared me for the level of for
I
what
know
I
what you
had
mean.
to learn. So, what advice would you give to someone coming into the STP next September?
Well, to be fair, I'd say, yeah, I knew before starting it that it was going to be very intense because I watched a lot of YouTube videos, day in the lives, like you're doing, which I think is so useful for people. So yeah, I kind of knew it was going to be very intense. But you know what? The advice I'd give is actually not to expect to know everything from day one. Like the STP is designed to train you. So I feel like people might get a lot of anxiety on how much you need to know, and you don't need to know everything. But yeah, I definitely say that. Also, being proactive in your training is very useful. Not every rotation is going to be well structured, and I wish I knew from kind of day one that is okay, and it's necessary sometimes to speak up and ask for opportunities or request like specific experiences that you need. But yeah, the other advice I'd kind of give is like, don't focus too much on your one file right at the start. I would say, if especially for people who haven't had much lab experience, focus on, building your experience in the lab, kind of building connections in the lab, having that sense of like teamwork and stuff in the lab is very useful, and you'll kind of gather evidence as you go along. You won't even realize sometimes that I actually have done this, like I can use this for my one file. So yeah, I would, just say
I
try
wish
not to stress too much about
I
it.
wish I got that advice before I started the SCP, because most of my experience was more academic lab than an NHS lab. So when I got in, I think I should have focused on getting used to the lab.
Yeah.
But after some time, I was trying to like start ticking some things off on one file, and it contributed to most of the stress I faced trying to get evidence rather than focusing on just getting used to the
Just
lab and
getting
getting
used to it,
to
right?
know everyone. I think that that's a good advice.
Yeah.
Then, looking into third year, how is your confidence growing as a clinical scientist? Because from third year, you'll be talking about your becoming qualified. So, how has your confidence grown so far?
Yeah, so working as a BMS before, I was quite confident in terms of the daily workflow in the hematology and transfusion labs, but I did come from a smaller hospital, so I didn't have experience in kind of the specialist tests or like, yeah, a lot of the things were new to me still. So in the STP, I feel like I've had a lot more like increased clinical engagement. So for example, attending clinics or multidisciplinary meetings to discuss like patient cases. And I feel like that's helped me to build a lot of my clinical knowledge. And also communication skills that are required. I mean, you have to talk to people of different various roles. Yeah, I feel like that's helped improve my confidence. I've also started working on my final year project, as I said, so I've become more comfortable in like navigating ambiguity and like problem solving, which are skills required for a clinical scientist. And I feel like that's helped to build my confidence in working more independently to kind of like plan timelines and like troubleshooting like practical issues as well.
Oh, that's really interesting. So, our final question would be, what has been your favorite part of the job so far?
My favorite part has been kind of like getting to see stuff that I didn't get to see before. So attending clinics and like multidisciplinary meetings and stuff actually has been quite my favorite part because I've just been able to learn so much from these things, and you're always learning, but like yeah, I found that useful. Also attending conferences and being able to see people who are in your role or in other roles and actually seeing all the work that they've carried out, it kind of, yeah, it's really interesting to see.
Yeah, yeah, that's really cool. Wow, it's been awesome speaking with you, and thank you so much, Priya. I really appreciate your time. Thank you so much for doing this with me,
That's
and
okay. Thank you so much for having me.
yeah, you're welcome.